I'm Kevin Adger with the Pima County Sheriff's Department. Behind me, the Pima County Jail. Inside those doors, about 2,000 inmates are housed. We're going inside, taking you inside, talking to Captain Stewart about how they are handling the coronavirus. Captain Stewart, so what if an agency comes in and they suspect somebody has the coronavirus, in the back of their car? What's the steps you guys take?
What we're asking them to do at this point in time is if they believe somebody's symptomatic in the back of their vehicle, to not bring them into the jail, but actually call the booking officers and request that the nurse respond to the secure lot. Obviously it's open, it's airy, and we're not contaminating anybody who may be inside the facility if it tests positive. So if an individual was symptomatic in the back of the vehicle, regardless if it's the COVID-19 or if they're flu, hepatitis, or anything else, we have this Decon locker where there's a bleach solution and all the materials they need to spray the back of their inmate compartment and clean it for the next step. Every arresting agency will bring their new arrestees here. Before they go any farther, they're going to be evaluated by our EMTs that we have hired through our contracted medical provider. They're looking for any kind of communicable diseases or injuries an individual may have. Obviously, because of the current culture, we're worried about coronavirus. But every day we're looking out for communicable diseases, hepatitis, drug-resistant strains of tuberculosis. What we do is we adjust our technique based on what's going on currently.
If somebody does have these symptoms or maybe test positive, why wouldn't you bring them to a hospital?
We have full medical services at the Pima County Jail, so it's common sense that we would house them in place instead of expose other people. And we have the resources through our medical provider, Centurion, to provide those services to them here. So until we know for sure, we have the resources to treat them and make sure that they're kept safe and we're not exposing other people to it. And because we have those resources, that's why we house them in place until we find out from the health department where they truly were positive or not. We have doctors on site 24/7. We have medical nurses, LPNs, we have physician's assistants, all on site 24/7. So to provide the care that they would need in that interim until we found out whether they were actually positive or not, we have those resources to provide that care.
I'm a registered nurse and I oversee the behavioral health contract with the jail. The medical vendor is who I oversee their services to be sure that we're giving good quality care. With the coronavirus right now, it's extremely important. We are taking aggressive steps to keep it contained if it does show up or when it does show up. So the initial, we call it a pre-booking screening. We use very specific questions to identify anybody who may have signs and symptoms of coronavirus or influenza or any other contagious disease. The minute we can get ahead of this and stay in front of it, that's success right there.
Do we have any cases? What is it right now?
Currently, we have no cases.